Hi everyone, in this session we'll talk about the anti-epileptic drugs. What are anti-epileptic drugs? Anti-epileptic drugs are those drugs which is used to relieve the epilepsy. Here in this session, first of all, we will talk about that what is epilepsy. Epilepsy it's a neurological disorder. It's a neurological disorder in which the electrical activity between the two neurons are very fast. Electrical activity of the neurons electrical activities of the neuron are fast. The electrical activity between the two neurons here in epileptic patient will be very fast electrical activity will be occur. Here in epileptic patient, the rapid firing of the neurons will be occur. Here in the epilepsy, there are several symptoms will be occur. Seizures will be occur, sometimes convulsion will also be occur. What is seizures? Seizures are the jerky or shaking movement of the body. It's a jerky movement of the body. It's a jerky or shaking movement of the body. But in convulsion, what is convulsion? Convulsion is also the jerky movement of the body. But here in seizure, sometimes jerky movement will be hard, but in convulsion, the jerky movement always will be occur here in the epilepsy. This is the convulsion. Normally there are two hemispheres of the human brain. There are two hemispheres of the human brain. Human brain are consist of two hemispheres. Normally the epilepsy are started from one hemisphere of the brain and then expand toward the next hemisphere of the brain. But the majority of the epileptic patient, the epilepsy arises from one hemisphere. First they will affect the first hemisphere and then it will arise to the second hemisphere of the human brain. Now the types of epilepsy. Types. There are generally there are two types of epilepsy. First is primary epilepsy. In primary epilepsy, these are the natural epilepsy, which is arise from the one hemisphere or from the second hemisphere of the human brain. Here the disease are not involved here in the primary epilepsy. No disease, it will not arise from the disease state, not arise from disease state. But the second types of epilepsy are secondary epilepsy. Second is secondary epilepsy. In secondary epilepsy, there are some disease which affect the human brain or some other disease which affected the human brain, the human hemisphere, and then epilepsy arises from this disease state. For example, meningeal infection, alcohol withdrawal, etc. These are some disease state which expand the symptom of the epilepsy. Now we will talk about the classification of epilepsy. There are two major classification of epilepsy. First is partial epilepsy. In partial epilepsy, the second name for partial epilepsy is focal epilepsy. Why it is called a focal epilepsy? Because they will focus on the small parts of the one or single hemisphere of the human brain. For example, this is the human brain. which is consists of two hemispheres. Human brain consists of two major hemispheres. In partial or focal epilepsy only, this is the first hemisphere. In partial epilepsy, here the first hemisphere or single hemisphere will be affected. Here small parts of the neuron will be affected in partial epilepsy, and then it will be expanded. When the first hemisphere are affected, so they will show the neuronal fast activity. Partial epilepsy are further divided into simple epilepsy. In simple epilepsy, the patient will not feel unconscious. Here in simple epilepsy. The second is complex. In complex, the unconsciousness will be occur here in the epilepsy. Second is generalized epilepsy. In generalized epilepsy, they will affect both of the hemisphere of the human brain. This is the two hemisphere of the human brain. In generalized epilepsy, they will affect both of the hemisphere of the human brain. Now we will talk about the pathophysiology of the epilepsy. Pathophysiology of epilepsy. For example, this is the neuronal structure. As we know that this is the presynaptic membrane and this is the postsynaptic membrane. Here in the presynaptic membrane for epileptic patient, the glutamate are play the most important role in epilepsy. Here the glutamate are present. Glutamate are the excitatory neurotransmitter. Here the glutamate are present here. The sodium channel present in here and other calcium channel are present in the presynaptic membrane. Here and other protein are present, which is name is SV2A. SV2A are actually the proteins. Here some vesicle are present in the presynaptic membrane in which store the glutamate. When the action potential are generated, the sodium channel will open. When the sodium channel will open, they will increase the calcium ion concentration inside the presynaptic membrane. But here normally the glutamate are stored in the vesicle, this vesicle with the help of SV2A protein. When they store here in the vesicle, for example, this is the glutamate neurotransmitter. When the action potential are generated, the sodium channel will open. They will increase the concentration of calcium channel inside the presynaptic membrane. When they increase the concentration of calcium ions inside the presynaptic membrane, they have the ability to fuse this vesicle to the membrane, to this membrane. And here they will release their glutamate towards this synaptic cleft. Here the glutamate will enter to this synaptic cleft, this synaptic space. Here in the postsynaptic membrane, two important receptors are present, which is names are NMDA receptor. Another is AMPA receptor. These two receptors play the most important role towards the attachment of glutamate. Here when the glutamate are released to the synaptic space, they will attack on the NMDA and AMPA receptor. When they attack on the NMDA and AMPA receptor, the NMDA receptor will increase the calcium ion concentration inside the postsynaptic membrane, and AMPA will enter the sodium ions towards the postsynaptic membrane. So here the positivity will be increased. When the positivity increase, unfortunately the depolarization will occur. Depolarization will occur and the contraction will be occur. The contraction of the body, the contraction of the muscle will be occur. Here another presynaptic membrane are present. This presynaptic membrane will also play the most important role in the epileptic patient activity. In this presynaptic membrane, here the GABA will be released. Here the GABA neurotransmitter will be released. For example, this is the vesicle. Here in this vesicle, GABA neurotransmitter are present. And as we know that the GABA neurotransmitter are inhibitory neurotransmitter. When they release from the presynaptic membrane and act toward this postsynaptic membrane, here in the postsynaptic membrane, here the GABA receptor are present. This is the GABA receptor. GABA receptor are present. This is the GABA receptor. Here when they attack toward this GABA receptor, here these are actually the chloride ions. These are actually the chloride ions receptor. When they attack toward this this receptor, they will increase the chloride ion inside the postsynaptic membrane. When they increase the chloride ion inside the postsynaptic membrane, and as we know that the negativity, when the negativity increase inside the postsynaptic membrane, they will cause the hyperpolarization. So here the depolarization and hyperpolarization occur. This is the normal phenomenon. This is the physiology of the epilepsy. This is the physiology. This neurotransmitter glutamate will cause the contraction, and this GABA will create the hyperpolarization or relaxation. So now we will talk about the pathology, that what will occur when these neuron, when these presynaptic membrane or postsynaptic membrane affected, and they will cause the epilepsy. So here we will talk about the pathology. So in the pathology of the epilepsy, normally this GABA receptor, this GABA neurotransmitter will not show their action. When they not show their action, so only glutamate will be come here toward this postsynaptic membrane 2 receptor, an MDA receptor and AMPA receptor, and they will show only the contraction of the body, only the contraction of the body, and they will show the rapid firing. Rapid firing will occur, rapid excitation will occur, so the jerky movement of the body will occur. Sometimes seizures will be occur. So there are some drugs which is responsible to relieve the symptoms of the epilepsy. First drug of choice which is used to block the sodium here. First we will block the sodium channel here to stop the depolarization. When the depolarization are stopped, so the glutamate will not release from the presynaptic membrane towards the postsynaptic membrane, and they will not show their excitatory function. The drug for the sodium channel blocker are phenytoin. Second is zonisamide, and third is lamotrigine. These three drugs play the most important role. These three drugs is a drug of choice to block the sodium channel. When the sodium channel are blocked, so unfortunately the depolarization will stop, and the phenomena of jerky movement, the phenomena of seizure will be stopped. These three drugs, phenytoin, zonisamide and lamotrigine. Second is second drug of choice which is used to block the calcium channel. Calcium channel blocker are Ethosuximide are the drug which is used to block the calcium channel. When the calcium channel are blocked, these are actually the calcium channel blocker. When they block the calcium channel, so calcium channel are responsible. When they open, The calcium ion will increase inside the presynaptic membrane, and they will move the neurotransmitter vesicle toward this membrane, and they will fuse toward this neurotransmitter vesicle to the membrane, and they will release this glutamate from it. So when they block, they will not show their activity and depolarization will not be occur. Third drug of choice which is used to stop the depolarization, SV2A blocker. These are actually the protein which is responsible to enter the glutamate toward this neurotransmitter. So there are two drugs which is used to stop, to block this SV2A protein. These two drugs are levetiracetam and brevactam. These two drugs will stop the activity of the SV2A protein. When they block this SV2A protein are responsible to enter the glutamate toward this vesicle, and they will stop when they block this SV2A protein. So unfortunately they will block the depolarization activity and excitation will not be occur. Other drugs which is responsible to block the AMPA receptor and NMDA receptor are the drug which are responsible to block the NMDA receptor are pilbamate, Pilbamate are the drugs which is responsible to block the activity of the NMDA receptor. And second drug which block the AMPA receptor are paramphenol. Paramphenol and pilbamate play the most important role to block the NMDA receptor and AMPA receptor. Unfortunately, when the NMDA receptor and AMPA receptor are blocked, so these are the glutamate receptor, and they are responsible to cause the depolarization, to cause the excitation. So when these receptors are blocked, glutamate are not show their action toward the postsynaptic membrane, and the jerky movement, the seizure will be relieved. Here another drug are used to increase the GABAergic activity. Normally we need to increase the GABAergic activity, we need to increase the GABA activity, because here mainly in epileptic patient the GABAergic activity will be lost, the GABAergic activity will be decreased. So in here when we need to increase the GABAergic activity, certain types of benzodiazepine are used and barbiturates are used to increase the GABA activity. Benzodiazepine like chlorazepam, diazepam, clonazepam, etc. are used to increase the GABAergic activity, and barbiturates are also used. Barbiturates are also used to increase GABAergic activity. Barbiturates like phenobarbital are also used to increase the GABAergic activity. When we increase the GABAergic activity, the GABA neurotransmitter will act on this receptor. They will increase the chloride ion inside the postsynaptic membrane, and they will cause the hyperpolarization. And when they cause the hyperpolarization, so the patient will relieve from seizure, from jerky movement, and from the symptom of the epilepsy. Here in the presynaptic membrane of this GABA, the enzyme are present. For example, this is the enzyme which name is transaminase enzyme. These transaminase enzymes are responsible for the metabolism of GABA neurotransmitter. So we need to inhibit the activity of this transaminase enzyme to increase the activity of the GABA. So the drug which is responsible to stop, to inhibit the transaminase enzyme are vigabatrin. Vigabatrin are used to inhibit the activity of this transaminase enzyme and to stop the metabolism of the GABA neurotransmitter. And when we inhibit the GABA neurotransmitter, the GABA inhibition or the GABA metabolism, so the GABA will act on this chloride ions and increase the chloride ion activity inside the postsynaptic membrane, which will cause the hyperpolarization. Here in this presynaptic membrane of the GABA neurotransmitter, one gate are present. This gate are responsible to again enter the GABA from this synaptic space toward this presynaptic membrane of the GABA. So when they in the pathological condition, this gate will again enter the GABA into this presynaptic membrane. So here the drug which is responsible to stop this gate, to inhibit this gate, and to inhibit the activity of GABA to enter again into this presynaptic membrane, the drugs are trigabine. For example, this is the drugs which stop this gate are trigabine. Trigabine are those drug medicine which is used to stop this gate, to increase the activity. When they stop this gate, the GABA neurotransmitter activity will be increased toward this postsynaptic membrane, and they will increase the chloride ion inside this postsynaptic membrane, and the hyperpolarization will occur. So they will decrease, they will relieve the symptom of the epileptic patient. So that's all about the anti-epileptic drugs.